everyone, welcome back to Sowkya Vision. Today we are going to discuss skull. Normally the study of skull is divided as based on the different normas to make study ease. Okay. Today we are going to discuss the first norma of the skull, norma verticalis. Is what is norma verticalis? When a skull is placed, see this is the skull. When we are viewing the skull, when we are seeing the skull from the above, from upwards, it looks like oval in shape. Yes, when we are viewing from above, it looks like oval, which is wider posteriorly. In the front, it is narrow, and when it is wider, it is more broader in the posterior side. Yes. Now, what are the bones that are forming norma verticalis? There are three main bones: frontal bone, which is a single bone; parietal bone. There are two parietal bones. Yes, this is one parietal and this is one parietal. Two parietal bones from either side come and meet at this suture. What is this suture? Sagittal suture. Yes, and another occipital bone, again single bone. Yes, from posterior side. What are the three main bones? Frontal, a pair of parietal and occipital. Frontal from anterior side, occipital from posterior side. On laterally, on either side, parietal bones come and join at the sagittal suture. These are the bones that are going to form norma verticalis. Now, what are the sutures that are present in the norma verticalis? There are three main sutures. They are coronal suture, sagittal suture, and lambdoid suture. What is coronal suture? It is present between frontal bone and the two parietal bones. These are the parietal bones on either side, and this is the frontal bone, squamous part of the frontal bone. This frontal bone and parietal bones are meeting at the coronal suture. This is the horizontal suture, is a coronal suture. Yes, this suture is connecting frontal with the two parietal bones. And what is sagittal suture? As I said, the sagittal suture where the two parietal bones on either side come and fuse at the sagittal suture. Yes, and the third suture is the lambdoid suture. The lambdoid suture is a suture where occipital bone is getting attached with the two parietal bones. In the front, frontal bone is getting attached to the parietal, whereas in the back, in the posterior aspect, occipital bone is getting attached to the parietal. Yes, there the coronal, sagittal, lambdoid sutures are formed. Now, there are some other features that we are going to discuss now. Number one is the bregma. What is bregma? See, this point is a bregma. Yes, the red circle is the bregma where the coronal suture meet the sagittal suture. As I said, the coronal suture is present between the frontal and the two parietal bones, and sagittal suture is connecting between the two parietal bones. Yes, with the point where coronal suture meeting the sagittal suture is known as bregma. Now, bregma, point where coronal and sagittal suture meet. It is the bregma. It represents anterior fontanelle in the fetal skull. Yes, anterior fontanelle in the fetal skull. And the second feature is what? Parietal eminence. Eminence is nothing but something elevation. If there is any elevation, that is known as eminence or tubercle. Yes, we have two parietal eminence, area of maximum convexity of the parietal bone. Here somewhere we will have the parietal eminence. Yes, 1 and 2 on either side of the parietal bones. Now, vertex. What is the vertex? Vertex is the highest point on the skull. Yes, it lies somewhere here. Yes, it lies somewhere here. Vertex is the highest point in the skull. Lies on sagittal suture behind bregma. As I said, this is the bregma. Bregma is the point where coronal suture and the sagittal suture are meeting. So our vertex is present behind bregma on the which represents the highest point on the norma verticalis. Yes, now parietal foramen. Parietal foramen. What is parietal foramen? The foramens present, this is one foramen and this is the another foramen. Yes, this is a foramen of this parietal bone and this is a foramen of this parietal bone. So there are two parietal foramen for each skull. Yes, parietal foramen is for small foramen in parietal bone near sagittal suture. This is a sagittal suture, right? This is a sagittal suture. So the foramen present on the parietal bone on either side of the sagittal suture are known as parietal foramen. Now, what is obelion? Or what is obelion? Obelion is a point between two parietal foramens. Yes, it is present along sagittal suture. This is the obelion. This is present along the sagittal suture. In between, as I said, these are the parietal foramens, right? It is present in between the two parietal foramens. It is known as obelion. Yes, these are the main features of the norma verticalis. You have to remember all the features like bones, sutures and main features like brygma, parietal eminence, obelion. These are the must to know points of norma verticalis. What are the bones that are involved? Squamous part of frontalis, squamous part of occipitalis and a pair of parietal bones. Easy, right? And what are the sutures? Only three sutures: coronal suture, sagittal suture and lambdoid suture. And other important points are brygma, parietal eminence, vertex and parietal foramen with obelion. This is the discussion of norma verticalis. If you have any doubt, please comment in the comment section. Subscribe to the channel. Namaste.